Shall we start with some misconceptions and some myths? Everybody knows, everybody in my line of work knows that 19% is a starting point for negotiations between health unions, most obviously nurses and the government. Everybody in the government knows that 19% is a starting point. So anybody using the line that 19% is unachievable or unsustainable or unreasonable is deceiving you deliberately. A deliberate deception, a disingenuous attempt to actually move the parameters of reality and introduce our old friend fake news. 19% is where you sit down and start, but they are refusing to sit down and start. Okay, that is misconception or myth number one. Myth number two is that you can somehow offer support for their pay desires, offer support for a pay rise without offering support for industrial action, because that is about as much use as a chocolate teapot. This is generational industrial action that's now been taken. First time that the ambulance workers have gone on strike, I think, in 30 years. First time in living memory that nurses have voted for national industrial action. You cannot support their quest for a pay rise unless you support the means they have at their disposal to achieve one. And they have exhausted every avenue. They have exhausted every opportunity. They have tried every tactic. And Rishi Sunak and Steve Barclay sit there saying, nope, sorry, we're not sitting down and we're not talking. So spare me the nonsense about 19% and spare me the absolute balderdash about being supportive of their desire for a pay rise, but somehow not supportive of their industrial action. Because you're not just lying to me, you're lying to yourself. And now we come to, even by the standards of this programme over the last 6 years, an astonishing vindication of a prediction that we only made yesterday. Do you remember when I said to you yesterday that they will try to portray healthcare workers as having blood on their hands? And the tactic, and it's not often I hit the ground 2 days running with exactly the same starting point, but the tactic is so transparent, so cynical and so clear that I can't believe it even needs explaining. Nurses, ambulance workers, healthcare professionals up and down this country do their job in large part because they are compassionate. Politicians, cabinet ministers, secretaries of state end up in the jobs that they've got in the current iteration of the Conservative Party in Brexit Britain because they are callous and quite often cretinous. Those are the key qualifications. Support for the idiocy of Brexit, self-interest, arrogance, cynicism and contempt for the people of this country. Those are the two qualifying factors. On the one hand, you need to be compassionate. On the other hand, you need to be callous. And the Conservative calculation right now is that their callousness will trump the health workers' compassion. So as the consequences of the industrial action increase, as potentially people suffer, even perhaps die, the government will try to portray it as being the fault of the healthcare workers rather than the responsibility of the politicians who refuse to talk to the representatives of the unions about pay. Right? Now, I said that to you yesterday, and as is often the case when I reach for my most passionately held opinions, there is a small voice, a still small voice of calm, somewhere in the back of my bonds that's saying, steady on, mate. Steady on, old pal. That's quite a reach. No, it's not a reach, because you've explained your thinking and you've based it on evidence, but that's a fairly swingeing criticism you're making of these people, you know? That's a pretty hefty allegation that you're laying at their door, that they will actually desire death or harm, or at least see it as something that improves and enhances their cause if and when people suffer. All right. And that's what I thought. Probably this exact moment yesterday, possibly 24 hours ago to the minute. As I glance at the clock and I see it's 8 minutes past 10 and I think, are you really going to go there? Are you really going to say that they will actively seek to make political capital out of the consequences of their own refusal to negotiate? And if you were listening yesterday, you'll know that I did. And then I did it again and again and then some and again. So even I was surprised to see it in such stark, black and white, disgusting terms on the front page of today's Daily Telegraph. Unions have made conscious choice to inflict harm on patients, says Barclay. And the front page of the Mail, how will they live with themselves if people die today. It has taken 24 hours for my grim prediction to be proved completely and heartbreakingly true. This government is calculating that with support for nurses currently standing at about 2/3, when the consequences of the government's refusal to talk to the nurses union about pay begin to bite, when the tragedies, if and when the tragedies occur, when the horrors unfold, somehow they will seek to portray it as the fault of the people taking industrial action in their minds to save the NHS, while the politicians tour the studios making disgusting allegations against people whose boots they are not fit to lace. Steve Barclay, Secretary of State for Health. Unions made conscious choice to inflict harm on patients. Where did you leave them? Where else could they turn? And I'll tell you something else that caught my eye today, because this is probably an underappreciated element of the whole story. I'm looking at stories about ambulances in particular, and A&E and overcrowding and queues. And these are scenarios that unfold when there are no strikes. The situation when there is no industrial action is incredible. Number of people dying in ambulances has gone up exponentially. The number of people stuck in corridors in hospitals, the number of people stuck in ambulances, queuing outside overcrowded A&Es. This is all happening when there is no industrial action. Okay? Industrial action is not happening and the NHS is on its knees. So for these, forgive me, for these disgusting individuals to turn around today and try to claim that industrial action taken by nurses who were brought to the brink of breakdown during the coronavirus lockdowns, paramedics who have to suffer the horror of seeing patients in the back of their ambulances visibly deteriorate while they're in a traffic jam because they can't get into an overcrowded A&E. For politicians to turn around today and claim that they will have blood on their hands, or that they have made a conscious choice to inflict harm on patients, is one of the most disgusting things you will ever see in British politics. I don't even know who Steve Barclay is, but I know exactly what he is. Opportunistic, dishonest, callous, cruel, disingenuous, deceitful, uncaring, contemptuous, and gross. Because that's the NHS they've had 12 years to sort out, and that's the NHS that's on his knees. And that's the second reason why nurses and paramedics are taking industrial action, because they fear that the whole shebang is under existential threat. So don't look at the consequences of the industrial action on the NHS. Look at the state of the NHS they are trying to protect. Sajid Javid broke cover last week with quiet calls for insurance-based health coverage in this country, to remove it from being free at the point of care for all applicants. We already know that huge swathes have been hived off into the private sector, because for these people, and again that little voice in the back of my head is saying, don't go too far, don't be too cutting, don't be too caustic. These people hate the very notion of a transaction taking place without any money being sliced off the top for investors and shareholders. It offends their very core. I don't know why, I never will. They look at allotments and wonder why they're not luxury flats, because allotments are for little people. They look at healthcare, they look at operations, they look at hospitals, and they think, how can nobody be making any profit out of this? How can there not be a kickback for the investors or this? Look, and if you doubt what I'm telling you, have a look at what happened with PPE provision.